Hello, this is Dr. David Bilstrom from the International Autoimmune Institute and the Autoimmune Lifestyle, and this is Did You Know? Here we come to you today from Cold Creek Canyon, about 3/4 of the way up Teton Pass, coming up from the west side, and one of our favorite trails. Still lots of snow, as it turns out, on the trail. There's probably about 10 tracks in the snow before us. Not in the sunny part like here, but in a lot of the shady parts. So somebody's done it, but not too many yet. And I'm not sure how far we'll get today, but this is just one of our favorite trails. What we're going to talk about today is about the new book coming out, A Nurse Practitioner's Guide to Autoimmune Medicine, Reversing and Preventing All Autoimmunity. And exclusively for readers of the book will be a secret code that gets you into a private room with additional information that we just couldn't fit into a book about the basics of how to do this kind of medicine. So we're going to go more into this in that secret room, in that private room. But what I want to talk about today is when you look at the health questionnaire, to go over it briefly before you see your patient for the first visit, how can you tell that their gut and immune system was totally disrupted already as a child, whether they're still a child or whether they're an adult? Well, one thing you can see is, let's say they have allergies and eczema, upregulated autoimmune issues, and they have recurrent infections like recurrent strep throat, recurrent sinus infections, or recurrent ear infections. Well, what you see right there is they have disrupted, lost the set point in the middle of the immune system, and they've gone up and down at the same time. So you know when you see that, they got disrupted gut, even if they don't check constipation, stomach aches, abdominal pain, those kind of questions that are asked. And so you know this person had a disrupted gut and immune system early on, and now you're seeing them years or decades later. You know it's had that much time to really mess things up. Even if you're seeing them before they have an autoimmune disease, you know where they're going. Now, what tends to happen a lot of times in kids is they get in this vicious cycle where they get an infection, got to take an antibiotic, disrupts the gut, which disrupts the immune system that surrounds the gut. So they get another infection, take another antibiotic, disrupts the gut, throws off the immune system, get another infection, after taking an antibiotic, throws up the gut, so they disrupts the immune system. You get this vicious cycle going, vroom, vroom, vroom. And by the time they work their way out of it, hopefully they eventually work their way out of this vicious cycle. But I have to tell you, I do see adults with recurrent ear infection still as an adult. It's crazy. Of course, recurrent sinus infections as an adult a lot of time. But you know that even before they left childhood, they had totally disrupted gut, totally disrupted immune system. Even if they're not getting those kind of infections again, even if they outgrew their asthma, let's say, you know they got a messed up gut and a messed up immune system already. So thank you so much. Talk soon.